Hi, my name is Taylor and I'm a dental hygienist here at Advanced Family Smiles in Northeast Philadelphia. Today we will be debunking some dental myths that people have. One of them is that people think it is good to brush immediately after eating. I would say not to do this because a lot of things that we eat, tomatoes, acidic foods, fruits, things like this, anything that's mixed in with our food, vinegars, dressings, salads, dressings, a lot of these foods are acidic. So if you're eating these, it's going to weaken the enamel because the pH of your mouth is now acidic. We would like to eat, maybe wait 20 minutes, a little bit more, then brush your teeth when your mouth reaches a more normal pH. I would not brush immediately after eating, even though people think this is gonna get my mouth clean so things aren't sitting on my teeth, but honestly the 20 minutes won't kill you and it'll protect the enamel a little bit more. Another one is if I have no oral health problems, I feel nothing going on in my mouth, do I need to come to the dentist? Do I need an exam? The answer is yes. A lot of oral manifestations present in the mouth with little to no symptoms. So we always recommend that you come see the dentist and the hygienist every 6 months at least to have your oral care taken care of, have your oral cancer screening, make sure that everything's in check. A lot of cavities, things like this, you won't really feel until they're too far along and they've reached the nerve, and that's when you're gonna start to feel things. If we can prevent that, we'd always like to do the least amount of treatment on you as possible and preserve the natural tooth structure that you have. So the answer is absolutely yes. You need to have an exam and you need to see your dental professional at least twice a year. Another myth that we have is that sugars cause cavities. This is true, but it's not only sugars. Some people that come in and we diagnose them that needing fillings or such, and they say, I don't even eat any sugar, like how am I getting these cavities? So sugar does cause cavities, sugar's on the teeth, but also carbohydrate substances, things that we eat, all of this. It gets, all this food in your mouth gets produced into acids on the teeth when they break down in the mouth. If you're not keeping up with your home care, if you're snacking a lot during the day and there's not enough time in between each meal for your mouth to reach a more normal pH, if it's constantly trying to fight off these acids that are being put into your mouth, then this is going to put you at an increased risk for cavities. So it's not only sugar, there's a lot of other things. Eating in general and not having the best oral hygiene, you want to make sure you're always flossing, always brushing twice a day for 2 minutes. If you can, limit snacking. You don't want to be constantly in the state of trying to protect your teeth where the pH of your mouth is up and down, fluctuating, and the acids are attacking your teeth. And definitely regular fluoride use will also help protect the teeth in this case. Our last one is that brushing harder is better, and a lot of patients feel this way, especially some of the older patients that don't have electric toothbrushes. They have the manual toothbrush and they brush until all of the bristles on the toothbrush look like this. We do not want to do that. If you have seen the video on our electric toothbrush, these electric toothbrushes have a sensor now for a reason. If we start this, you'll see that this will light up white. If you're using it at the proper pressure, it's gonna turn green. If we're brushing too hard, it turns red. This is because when you brush too hard, it causes abrasion of the tooth enamel. That means it's starting to wear away the tooth enamel because you're putting so much pressure on it and it's too coarse. Basically, you're putting too much pressure and movement on the teeth that it's starting to wear away some of the enamel. Not only the enamel, but also the gums. People that brush really, really hard, we see a lot of recession on because they're brushing horizontally very hard. The gums don't like to have all that irritation on them. So if they're having this constant source of irritation, they're gonna start to recede. This is a problem because when the gums start to recede, patients experience a lot of sensitivity because these pieces of the tooth are not covered by enamel. So they have more direct sources to the tubules of the dentin, which is causing a lot of sensitivity for people. Also, they puts them at increased risk for root caries. Because this piece of the tooth is not covered by enamel, it's also softer. It's also a lot more prone to decay. So if you can, I would recommend to everyone to get their hands on an electric toothbrush, specifically one with a pressure sensor like this so that you can avoid these things. Brushing harder is not better.